In your case, the joint showing signs of duress, signs of strain.
I have
From that, we need to-
been wowed every time I have come here. The staff is exceptional, as well as, of course, Dr. Becker. Literally, I hate getting up from my chair when it's time to go. I feel so comfortable.
My name is Dr. Ray Becker, and I'm a practicing dentist here at Howard County Smiles. Howard County Smiles is a dental practice which is a comprehensive care practice. We've been in this area for over 32 years. We take care of patients of all ages, for patients that are from ages 3 to 93. We work on patients in a comprehensive manner, which means that we look at every patient individually and see what their needs are and help to treatment plan them towards total health. Being a dentist for 32 years, we have the ability to do a wide range of services. We are able to take care of a wide range of patients' needs, whether it's the child for pediatric type needs, or if it's for the patient who might have issues with their jaw joint, or for prosthetics, implant dentistry, orthodontics. We do a lot of cosmetic work. I've been involved in that my entire career. In the field of crowns or caps for patients, basically the procedure is typically done in multiple visits. There's messy temporaries, messy impressions. It's sent to a lab. You have a temporary that's put on the tooth for a period of time, and then you have to come back and then have the crown refitted. With the CEREC machine, we can actually create crowns, veneers, and restorations live. So we don't have to send them all to a lab and hope that they match. We actually make sure that they match by doing it right here. Created a variety of techniques to allow us to be able to color map and to understand how an individual tooth has layers and how we can create an aesthetic restoration for them. We're doing it one-on-one instead of just hoping that somebody understands a script or a photo that we sent them. And with the CEREC technique, we're able to do that in one sitting. So a patient comes in and literally the procedure is done as they sit here and watch. We have the equipment to mill the restoration while the patient watches it with a 7-axis milling machine. And then we stand and glaze the crown right as they wait, and they walk out with the final product in as little as an hour and a half to 2 hours. We do a lot of work with teeth whitening. It's probably one of the most popular procedures. It involves and corrects every tooth in your mouth for one service. We have a variety of approaches to that. We use the zoom technique, which allows us to get an amazing positive result for our patients. You can get up to 10 shade whitenings in one sitting with that technique with no discomfort at all. We also use sensational smiles, which is a technique that you can use here. It's a 20-minute visit that patient can come in, and a lot of times they'll do that at the time of their cleaning to maximize those results. So those are very, very well-received systems that patients seem to really, really take to.
That's why tap, why tap.
65% of the human population does have some form of noise, discomfort, issues that go on in their joint or their facial area. Now, of those patients, not all of them will require treatment, not all of them will have an issue that progresses, but certainly there are those that will. So the interesting and important part is to be able to understand and objectively diagnose, evaluate, and treat the individual based on their particular needs. So a lot of times people will notice a clicking or a popping in their joint. They'll wake up in the morning, they may have headaches, they may notice they break their teeth or they have problems with restorations that don't have a lot of longevity, and they just don't feel good in general. So that's one of the first signs, but typically that's not the sign that's not the time you want to wait for it to be a problem. You can head it off at the pass by noticing if there's an issue with the joint. Most patients refer to issues with their jaw and their head and neck and their face or discomfort as TMJ. It's actually more likely and more commonly referred to as TMD. TMD is an umbrella term which stands for temporomandibular dysfunction or disorder. It's actually a compilation of over 38 different conditions that could be the concern for that particular individual. Everything from headaches to orofacial pain, to say even a toothache, but the important part is being able to diagnose and accurately assess where that particular individual's needs are. And we use objective tools and equipment to be able to get an objective perspective of where that particular patient's needs would best be treated. It's really important to unravel the root cause. It's usually a compilation of things. It's a combination of how the teeth, the muscles, and the joint interact. And that's where it gets a little complex. So the dentist has to have the capacity to understand those differences, to be able to see the interplay of those three systems, and to be able to diagnose and scale the treatment towards what that particular patient's needs might be. We do a screening on patients called the JVA Quick. And what that is basically is a tool that lets us see if there is any noise in the particular individual's joint. And with the JVA, with a great degree of accuracy, we can determine is this joint damaged or is it healthy, which lets us move into the proper modality for that particular patient. And basically it's a simple test that you just place headphones onto, they're called accelerometers, onto the patient's ear area where the joint is located. And it basically, as they open and close, it looks to see if there's any noise that's generated by that function. So the test itself will give us different data and diagnostics that give us a very clear understanding of what exact damage, is it damaged, what exact damage is there. The diagnostic process is probably the most important part of the whole entire equation. From that, we determine what's the most likely cause. So the more data that you get, the more objectivity that you get, the more clear understanding you can have of that particular patient's concerns. The JVA Quick lets us know, is the joint damaged or is it healthy? So that eliminates a lot of the potential things that could be in that patient's differential diagnosis. Some of the possible solutions and treatments are widely ranging. You could have a very simple issue where you could have just your teeth adjusted. It could be that you need to have a night guard made. Most often though, patients with TMD, you can control the issues if you treat them early enough with some very simple measures. The concern is not to let it continue to where it becomes a bigger problem, and then it's a much more difficult thing to unravel. That's one of the tenets of what we like to do here at Howard County Smiles, being proactive versus reactive. We like to sit there and understand where a patient truly is coming from so that we can help them get to a better state of health.
And once I came here, he made me this appliance that sits at the top of my mouth, and I can now sleep and have my headache reduction is like a 98%.
We are honored to be at this year's Women's Fest, where we'll be screening people for TMD. So if you're concerned about this issue or if you want to get more information, we will be using the JVA Quick to be able to assess whether a patient's jaw joint is healthy or not healthy. If you're an individual or a family looking for dental services, please feel free to contact us for a comprehensive evaluation and care at Howard County Smiles. We love to see patients of all ages from 3 to 93.